is a Canadian physicist and former professor at the University of Ottawa, where he taught over 20 years. He holds a PhD in physics from the University of Toronto, has published over 100 peer-reviewed scientific articles. His research, based on all-cause mortality, data shows there was no viral pandemic and attributes excess deaths to government policies, medical protocols, and vaccines rather than the virus. Please give a warm welcome to Denis Rancourt.
That should be on, right? Nothing's happening. Yeah, that's on. All right, first slide, please. Yeah, that's an obvious one. Okay, this is the short title of my presentation, Mortality. And I do forensic epidemiology. That's what I do. I try to get to the bottom of what's happening on the basis of data. Oh, I'm supposed to click, which way do I click? There it is. That's the fancy title of the presentation. And that's your speaker. And this is just to say that I had the occasion to talk with this gentleman, and I had the occasion to... I was able to express some of my more radical ideas, and he was able to hear them, and I think I may have had a small influence on some of his thinking, so I'm very happy about that. And this is the nonprofit organization that I do all my work with, and with various scientists and so on. So all of our research is there. The two main people who have been involved in this presentation and the data that I'll be showing are Marine Baudin and Joseph Hickey. And we have a large website where we have many large reports, hundreds of pages each report. And so far, in the COVID area, we have done 24 detailed science reports. Some of them are like 400 pages. Lots of graphs, lots of things. It's just an enormous amount of data, which even government scientists are not looking at, but they should be looking at it because it's very important. And this is a plan of the presentation. Very quickly, I'll talk about Canada, the Canadian data, mortality, and so on. I'll move on to Alberta, and I'll give you some conclusions. And this is the type of data that I've been analyzing. Mortality, so-called COVID death, assigned death due to COVID by the government, various kinds of causes of death, and socioeconomic parameters, that more than 70 of them, to try and understand what's happening at the same time as these excess deaths. And I'll start with Canada, and this is for the international viewers, just to position things. And this is, to start with, someone we all know. Theresa Tam wrote a scientific article in which she claimed, with her co-authors, that they had, by their measures, saved approximately 1 million lives in Canada. And we wrote a paper, this is graphs on the paper here. Okay, so we wrote a paper showing that Theresa Tam's conclusions are complete fabulation. There is no way that they averted 1 million deaths. That would be equivalent to a world war in Canada on Canadian soil. So it's just crazy. That is nonsense right there. And we proved that mathematically. And so now this is the kind of data that I'm going to be telling you about. It's mortality data. So we're just counting deaths. It's something all countries do. They do it very well. You know when someone dies, how old they were, where they died, and on a per-week basis, you look at this all-cause mortality, and this is for some of the large provinces in Canada, and you see that it has a seasonal pattern up and down. There are more deaths in the winter, and guess what? Scientists don't really know in detail why that is. Okay, there's a lot of conflicting theories and so on, but that is still something that is not completely understood. These dashed lines here are, these dashed lines represent the declared start of the COVID pandemic, so-called pandemic. That's the declared end of the pandemic. Right after the start of the pandemic, there was this huge peak in excess mortality that is in some provinces, Ontario and Quebec especially, but it did not occur in Alberta. And This is the Canadian data, but now on a per age group basis. So older people die more, you can see that here. And this is to show that we've studied all these socioeconomic parameters with very sophisticated statistical techniques to look at correlations and things like that to understand we're trying to understand. We're doing forensics, we're trying to see what's going on. This is to show that in Quebec, Montreal had this huge peak of excess mortality. They were killing elderly people in hospitals and care homes. As soon as they announced the beginning of the pandemic, it was like giving a free hand to all these medically eager staff who decided that, you know, there was this pandemic and we have to do something to help them. And the something they did actually killed an awful lot of people. So those deaths occurred only in Montreal. Everywhere else in Quebec, there are no deaths of that type. The same happened in Toronto, but virtually nowhere else in Ontario. New York City had these kinds of deaths, but almost none everywhere else in the US, and so on. So this is right away we said that is, a virus doesn't wait for you to announce a pandemic and then decide to start killing people. That's ridiculous. This is a political decision, and it has political consequences, and that's the consequence in mortality. And so we showed that. And now I want to show you how the method works. You've got all-cause mortality in light blue. The dark blue there is our clever theory to propagate what the mortality should have been into the future. So we're using the reference period of 2015 to 2019, and then we project forward what mortality should have been, and it's lower than what it actually was. And the difference is what we call the excess mortality in brown below there. And you can project back as well, and you can see that our theoretical understanding, our modeling is very good. This is a technique that we developed, and that's excess mortality on the bottom there. You can see this little, there's a lot of detail here. See that little peak? That's a heat wave that occurred in BC, and it killed people. That's the kind of thing you can see in this kind of data. So now you can also see winters that are more severe and winters that are less severe before the COVID period starts here, and then you see all this excess mortality. So this is a blow-up of that excess mortality. This is excess mortality, mortality that should not have occurred, that would not have occurred if they hadn't declared a pandemic, in my view, having studied all of this, per week, as a function of time here. And what you see is that first peak one, which is that killing of elderly people in care homes and so on. This is a peak that happened the first winter when they had horrible lockdowns. Then we start vaccinating. So the doses 1 and 2 cause peaks. That's the heat wave in BC. This is the first booster that came out. The first booster was rolled out very quickly, and it coincides with a very sharp peak in excess mortality. And we see this in almost 100 countries around the world. So they rolled out the first boosters simultaneously in both the northern and the southern hemisphere. They did it quickly, military style, and you see this peak everywhere where they did it. So that's very clear proof that we've demonstrated that there's an association there. Then the second booster, they rolled out more slowly, so you get this rise. As soon as they leave the hospital and they finish putting out the boosters, you get a drop in mortality. Then they come up with a third booster, and then you get a drop when they're done. And so there's this sawtooth pattern that coincides, that is synchronous with the rollout of boosters. That's what you see in the excess mortality. You can express that excess mortality as what we call a p-score, which is a percentage of the deaths that normally would have occurred that week in this jurisdiction, the percentage of death that occurs. So this is what it looks like for Canada. This is what it looks like blown up and compared to the actual vaccine rollouts. Every time they finish rolling out a vaccine, you get a drop here. And when they stop killing people in the old folks' home because they've done enough, you get a drop. And when the winter's over and they loosen up on the lockdowns, you get a drop, and then they start vaccinating. So you can see that there's a relationship between the excess mortality and the vaccination. This is the excess mortality for Canada, but for the age group 0 to 44 years. And you can see that as soon as you start, you declare the pandemic, you rise up to a higher level of excess mortality. And then beyond the official pandemic, it just stays there. This is what we call persistent excess mortality, and we see it in all the Western countries. The Western countries continue to have excess mortality beyond the end of the pandemic. This is the same thing shown on a different scale. Actually, it wasn't the same thing. It was for the 65 to 84-year-olds. This is for the 85-plus-year-olds. Now, this is very important. This is excess mortality, so mortality that shouldn't have occurred compared to the zero line here. For 85-plus-year-olds, that big peak in Canada. Now, notice this. After you get a peak, it comes down below zero. After you get a peak, it comes down below zero. After you get a peak, it comes down below zero. That's called the dry tinder effect. What that means is you so aggressively killed people in that peak that there's no people left to kill immediately after. They die less. So this is a forensic demonstration that these were assaults against elderly people. This is the proof that these were clearly assaults. And so after this wave of death, there's just less people to die in the coming weeks at that age. Okay? This is to show that you can actually quantify all of this. So in Canada, it's 81.6 thousand excess deaths during the COVID period alone. And after the COVID period, you continue to have about 26,000 deaths per year of excess mortality. It just continues, okay? We'll do the same thing for Alberta in a minute. Okay, this is a comparison between the all-cause mortality, the excess all-cause mortality, and the government-claimed COVID deaths in black. And what we see is if you take the difference, they agree when they're saying that these are COVID deaths because they were respiratory deaths because they were elderly people, and when you stress out and assault elderly people, they usually die of respiratory pneumonia. So there's a coincidence there. And then you get a situation over here where this brown line is negative, which means there are far more COVID deaths declared than actual excess mortality. Okay? So they're declaring more COVID deaths. So what that would have to mean, if you want to believe them, is that the COVID is causing the other causes not to cause death. Okay, that's the situation you get in. And then later on, they admit they're not declaring COVID deaths anymore, but you continue to have these spikes in excess mortality that are temporally associated with all the rollouts that just continue. Okay, that's what's going on there. Then you can calculate the number of years of life lost that correspond to this excess mortality. You can do it on a per week basis for males in Canada. You can do it for females in Canada. You can calculate the total. And in Canada, 1.5 million years of life were lost because the government assaulted us. In Alberta alone, 315,000 years of life were lost in the COVID period. In Alberta, the P-score, which is the percent higher death compared to normal, is almost 15%. It is the highest in Canada. No other province has such a high number. So these are these high P-scores for the different provinces. Here's Alberta. Saskatchewan is also high. Newfoundland is also high. All the other provinces are lower. Why is that? Well, let me show you a graph, another graph. This is the GDP per person in the energy and mining sectors for the provinces. And so you have high values for Alberta and Saskatchewan and Netherlands, only those. That's where all the big excess deaths were. You shut down an economy where a lot of people are working and their lives depend on it, and a lot of people die. So now, more specifically in Alberta, this is what the by age mortality looks like. This is what it looks like if you normalize it to the number of people in that age. So the older you are, the more chance you have of dying in the coming year. I'm sure you know that. But it actually follows a mathematical law, an exponential law, that's been known for about 100 years, and there still is not a good scientific explanation as to why that law and why the doubling time of that death is about 10 years. So just to show you that science doesn't know everything. This is the quantitative method for Alberta. This is what the excess mortality looks like for Alberta. So you notice that there isn't that peak at the beginning. So Alberta did not viciously kill elderly people right when the pandemic was announced. Okay? They waited a bit. And in the first winter, they had vicious protocols and lockdowns and everything, and it really was a disaster here, this big peak. This is what it looks like compared to the vaccine rollouts. This is what it looks like compared to Ontario. So Ontario and Alberta can be compared in detail. There's some really important differences. I don't really have time to go through it, but this is the comparison between Ontario and Alberta for the age group 0 to 44-year-olds. And this is where you see that in this age group, the death rate in Alberta is much, much higher than anywhere else in Canada, and Ontario in particular. It can even reach 100% per week during the COVID period. This is now for the 85-plus-year-olds, where you can really compare what was done to the more elderly people. And now I looked at municipalities in Alberta, and I found that these three, St. Albert, Spruce Grove, Airdrie, did not experience a pandemic. There was no excess mortality there. So when you lived in a nice home in one of these neighborhoods, and you sit and do Zoom calls and order things in and have a nice life, you don't die from this pandemic. The virus doesn't go to your house, okay? Now, this is a comparison between excess mortality by year in Alberta and the declared COVID deaths. So the first slide is for all ages together. The next slide is for 65-plus-year-olds. So you see that in the first 2 years of the declared pandemic, there's agreement between what I'll call respiratory deaths, what they're calling COVID deaths, and the total excess mortality. Then if you go to younger age groups, you see that there's a lot of causes of death other than COVID necessarily. And if you go to the really young age groups, like 18 to 44-year-olds, there's virtually no declared COVID deaths, according to the government, yet a huge death rate for these young people, 1,000 deaths per year extra that should not have occurred. If you go down to even the 0 to 17-year-olds, you still have about 100 extra deaths per year that you shouldn't have that cannot be due to COVID, according to the government's own data. So what is causing these deaths? That's the question. So I want to just pause and read this very important statement. One of the greatest medical researchers in the modern era was a Canadian. His name was Dr. Hans Seeley. He worked at McGill University in Montreal. He is the father of the scientific study of psychological and biological stress. He won every prize you can win in his area except the Nobel Prize. And he said this about death. He said, some diseases have specific causes, the direct actions of certain particular disease-producing agents such as microbes, poisons, or physical injuries. Many more diseases are not caused by any one thing in particular. They result from the body's own response to some unusual situation. This is something that they should teach much more aggressively in medical school because a lot of MDs appear not to know this. It's very important. So now let's look at causes of death with an eye to Hans Seeley's work. And so I just picked some here. We've got heart attacks, diabetes deaths, you fall, you injure yourself and it causes death, alcoholic liver disease. Alcoholic liver disease shoots up at the pandemic for the 18 to 44-year-olds. It also goes up for these not so young people. Heart attacks go way up for the 45 to 64-year-olds and so on. Diabetes deaths are dramatically increased during COVID, maybe as a result of self-harm from binging on sugar. That's a hypothesis. Now we look at the leading causes of death, and this is for ages 65 and over in Alberta. And we see the declared COVID deaths here. We see the usual sequence, cancer, heart disease, and so on. And if we go to younger age groups, 45 to 64, now you start to see something happening. you start to see in black here deaths, accidental poisoning due to substances. That's basically drug overdoses, and it's usually fentanyl these days, okay? So that's the black curve, which is now the third leading cause of death during COVID for this age group. Now, if I go to the next age group, 18 to 44-year-olds, those fentanyl deaths are through the roof. It is by far the biggest cause of absolute death. It's all around everything death. If you add all the causes together, it's 100%. It's all deaths. So this is a massive death rate due to accidental poisoning from substances, meaning fentanyl, okay, for the 18 to 44-year-olds. And then if you, the next one below, the next one is, guess what? Suicides. But that's been the case even before COVID. So that's just a comment on our society. For the 0 to 17-year-olds, it is striking that you still have a lot of fentanyl deaths. And it is also striking that suicide is on the rise, even before COVID, in this age group. So we're trying to understand what causes these deaths. And the main correlation that I found is with the price of crude oil. So the price of crude oil had a huge drop here in 2014 when they were attacking Russia by trying to take away its revenue by dropping the price of crude oil. It's a geopolitical event. This is also a geopolitical event. It's called COVID event. Big drop there, okay? And if you look at 30 to 39-year-olds, all-cause mortality by the population of those ages, and you have those two dates here, you see all-cause mortality raise and then rise again in conjunction with these incitements due to the drop of crude oil. And the same thing is true of 20 to 29-year-olds. And now, this is a very important slide. I'm just going to spend a moment on this. This shows unemployment rate in 3 provinces as a function of time since 1975, okay? So there's a first huge rise here, 0.1. That is around 1982 when China was brought into the capitalist trade system by the USA. China joined the world trade, the US invested in China big time, and there was huge unemployment increase in the Western world, in the US and Canada in particular. Then here, now every time there's big increases in unemployment, there's increases in mortality, especially of workers and so on, and the people they depend on. And here, the second event of increased unemployment is the dissolution of the USSR. When the USSR fell apart in 1992, that had a huge effect on our lives because the US decided that it could now own the world, and it aggressively increased its globalization. So corporate, US corporations just basically took over much of the Western world, and that caused huge increase in many places in unemployment. The third event here is the 2008 financial crisis. This is that first drop in crude oil that I told you about. So you see that it causes unemployment in Alberta, but not in these other provinces. And then the COVID geopolitical event causes unemployment everywhere. They closed everything down. So this is how you can start to understand these things. What I'm trying to say is our lives and even our health is dramatically affected by geopolitical events. These are huge forces that by a multitude of mechanisms dramatically affect our lives. And so in conclusion, COVID was a large-scale coordinated societal assault. And it had all of these consequences in terms of what they were doing to us. As a result, there is chronic biological stress and trauma from that assault. And this has a huge impact on your individual biology. It can make you sick in a whole multitude of ways. And therefore, as a result of that stress, there are immediate deaths of the sick and elderly through pneumonia. And I wrote a whole paper to explain that pneumonia doesn't even have to be transmitted. It can be self-infection from the biota that are already in your lungs. And so people can just develop pneumonia. If you stress them out and you isolate them, they will die of pneumonia, and that's what happened. And the midlife adults, heart attacks and so on, midlife adults and younger people, a lot of addictions and self-harm behavior. But the point you have to understand here, the final point in my conclusion is that the changes that were imposed during COVID became permanent. How they treat the elderly, mistreat the elderly in care homes and hospitals has become their permanent practice. They isolate them, they treat them like they can be contagious or they can catch something. They give them flu shots, they give them COVID shots continuously, and all the usual pharma treatments. This was increased during COVID, and that new regime has been maintained. So we're continuing to kill elderly and frail people in this way. That's part of the explanation of this persistent excess mortality. The other part is that when you have a lot of people who take on harmful self-harm behavior, this becomes part of their habits, and they can become addicts, and even if they don't, it's part of their habit to cope. It's self-medication, and they can, by accident, die. And I think that's a big part of it, and you see it in the younger age groups as well. So as a result of COVID, this huge impact that it had on our society for many years, a lot of the changes that were imposed by that have been kept, have been maintained. So we have to ratchet back the horrible treatment of elderly people and say, to hell with your ideas and your theories about health and about disease and about contagion. We are not going to isolate our elderly. We're not going to treat them inhumanely this way. So that's one of the main conclusions here. Our data, which is we show persistent excess mortality, increased mortality even among the young, the dry tinder effect among the most elderly, which really demonstrates that you're assaulting them. All of these things are indicators, and I'm going to be harsh here, of a sick and collapsing society, a corrupt society. So when your infant mortality is increasing, when you're killing the elderly, when you're being cruel, when you're creating conditions to the point where people start looking for escape and self-harm behaviors, then you have a sick and corrupt society. It's corrupt because all the institutions are participating in it. The people who want to make profit are participating in that. So that is the main conclusion. Regarding healing, well, I would say the answer is solidarity, community, social links, so that's support. Becoming political, I don't have to tell you in Alberta about that. That's influence. And then read, discuss, learn, argue, compare. That's self-knowledge of your place in the world and what your body's really like and knowing yourself and all that. And this is something that I cannot not say. I have read a lot of scientific papers that demonstrate that the single thing you can do in the Western world to increase your health is to walk at least 30 minutes a day. It's just incredible. So there are serious, peer-reviewed, many scientific papers that demonstrate this unambiguously, that this will increase your health more than whatever you eat, whatever medications that is helping you with high blood pressure. All of these things are not beneficial compared to simply walking at least 30 minutes a day. So I felt I need to say that because some of us forget to do it. And the final thing is, please read my latest report, January 29, 2025. It's about infant vaccination programs. It will blow your mind. Because in that report, I explain the degree and the depth to which the pharma system and the medical establishment are corrupt. And you cannot believe anything they say. And the so-called controlled medical trials that show a benefit to these vaccines are completely fabricated. They're concocted. They're corrupt. You cannot believe it. And I demonstrate that in some detail in this article. So if you're into reading that, you're welcome to.
Today, we're up against time. Any final thoughts before we...
Okay, well, my final thought is what this gentleman said. All of this was orchestrated. There you go.
Dr. Denis Rancourt.